Action. Thank you so much for joining us today. We are here to share gems about how to attain, maintain, and reclaim your perfect health. So grab your good doctor notebook because I've got another good doctor joining us today, and you're not going to want to miss a minute of it. So join me on Twitter at Ask the Good Doc, on Instagram and Facebook at Ask the Good Doctor, and don't forget to subscribe to my YouTube channel. Right? Do it. Yes, education, longevity will be there forever and ever. All right. You need to know all of these wonderful gems that we are sharing with you. With us today, I have a wonderful guest. She's my sister, she's my friend, she's a colleague, and she is the Fit Doc, and she's a board certified family physician. Welcome, Michele Reed. Hello, Dr. Michele.
Hello, I am so excited to be with you today.
Oh, I am happy that you are here. We have finally made this happen.
Yes, most
We have
definitely.
4 years in the making, actually, and it took a pandemic for us to be able to find out time in our schedules to do this. But here we are. It's really noteworthy to mention most immediately that Dr. Michele is a medical doctor, and she is one who sees many patients from the community where she is based in Long Island and in Queens. She has two offices.
Yes.
And Dr. Michele succumbed to the COVID virus very early in the pandemic. Tell us about your experience, Dr. Michele.
Well, I was diagnosed with COVID probably, I think, the first week of April. But as someone who likes to exercise, somebody who is very in tune with their body, my first sign that I had was an increased heart rate, and that was the end of March. And that's why I like to stress to everyone, it's important to know your body, be in touch. So any little thing that you can recognize is going to be a change. And the sooner you can be proactive, we don't have to be reactive at the end.
That's right. That's right. That's our mantra right here on this team. Stay ready so you don't have to get ready.
That's right. That's right.
It.
So the sheer fact that I knew what something different was going on, I knew what to do. I knew I needed to go rest, continue to get my sleep, to stay hydrated, to continue to take my vitamins and my herbs that I normally did, and to isolate myself from my family, which I think is the key thing. Is when you are sick, there is no reason for you to go to the grocery store. There's no reason to decide that you need to go get your hair done or your nails done, because all you're doing is spreading it to other people.
So, well, first of all, wait, I need you to pause because you are running everything in the first minute of the show. We need to take everything just point by point carefully, because you said the first key thing was that you noticed your heart rate was elevated.
Mm-hmm.
You're in tip-top condition. When I tell you this woman is in shape, this woman is in shape. Okay. She kettleballs and runs marathons and swims. I mean, she's branded the Fit Doc, literally. So when you say that your heart rate was elevated, Dr. Michele, it went from what is your baseline? First of all, being in such great physical fitness, being so physically fit. Your baseline is certainly different from most. And so what was your baseline, and what did an elevated heart rate look like for you?
So my baseline is normally 68 to 75. That's my normal rate. This particular day when I woke up, my heart rate was 110, which is very unusual for me. Never, because I wasn't even exercising. I just woke up, heart is beating quickly. Didn't have to hear that people say, okay, when you go to the doctor's office or when you go to certain restaurants where they check your temperature, I didn't have that. But I had the virus, and I knew I had the virus because, one, as a doctor, we had been seeing patients in both my locations. Many of them, even though we had the sign up saying, if you have any of these symptoms of fever, vomiting, diarrhea, shortness of breath, to call the office before you try and come in, we would see people who were short of breath. We had to let them in. We couldn't sit them and let them have them wait until 911 came, because we had to triage them, give them oxygen. So I pretty much knew, because everybody who ended up going to the hospital from both my locations, which were in the center of the epidemic, in
Ah,
Long Island and Southeast Queens, everybody was coming back and letting us know by call, of course, that they had tested positive for COVID-19 and their family members. So we knew it was only a matter of time that, of course, we probably would get it because we were getting hit hard as far as my office. So listening to my body that morning when I woke up with that increased heart rate, I knew something was wrong and I went to go get tested immediately. And I didn't get, because of course, sometimes we have a little delay in medicine. I did not get my results till about 7 to 8 days later.
wow.
At that time, I had already, as soon as I got my test, I went and I isolated myself.
Okay. Woo. What was going on in your head when you woke up with that heart rate of 110?
Well, as a Christian, I knew no matter what I was going through, that God was going to take care of me. But my immediate thing was, okay, I have to make sure that my family doesn't get sick,
Mm-hmm.
because we do in my household have two individuals that have immunocompromised systems. And then my next, of course, is to make sure that my patients and my staff were going to be okay.
Yes.
So those were my concerns, because we already were seeing patients in person. We were set up to start doing telemedicine. So it was a matter of us turning on the switch to start with the telemedicine, because pretty soon other people in my practice, of course, ended up testing positive. So we eventually had to close down the office for
Sure.
a couple of weeks just to make sure everyone got healthy, and to make sure too that we truly knew that people had COVID-19. And there are so many which ways that we can go with this, but it's very important that you do listen to your body, because not
Amen.
everybody presents
Good.
with fever, not everybody presents with cough and vomiting and diarrhea. Sometimes it's just that you don't feel something is right in your body.
That's right. Why didn't you go to the hospital?
Well, for one, I knew that I was not having severe shortness of breath. It was just that increased heart rate. And I did not consider myself to be an emergency. I knew exactly what I needed to do. I even called my doctor and I already told him what I was doing. And he said, okay, if you need anything, just let me know. And what he would do every couple of days would just be to check in to see how I was doing.
Okay. I'm glad that you're a physician. Would you recommend that other people do the same thing, that they stay home?
If you do not feel right at all, you need to stay home. And you also need to isolate yourself from your members of your household. I mean, I can't
Yes.
stress that enough. Some people are like, well, I just want everyone to get sick. You might want everyone to get sick, but you don't know the impact it has on different people's body.
Yeah.
I've had some households in my practice who've told me that, some people present like sinus infections. Another person in the household might have vomiting or diarrhea.
Mm-hmm.
But luckily for us, as far as my patient population, we didn't have any children that became very ill that had to be hospitalized, because that's also one of the key things that you need to make sure, that if a child gets sick, that they still stay well hydrated, that
Yes.
if you have a fever, that you control your child's fever, because any little thing can cause it to become a visit to the emergency room and a hospitalization, especially if they get dehydrated.
Very true. Talk to us about the importance of that water. Oh, you are in my blood. And I know that this audience gets tired of me having the water conversation, but we're going to hear it from an additional doc right now, one of our good doctor family members. Tell him, Doc.
So I like to say, like, I love water so much so, look who's right next to me. So I say, take your body weight, divide it by 2, put ounces on the end. So if you weigh 160 divided by 2, that's 80 ounces. And people are like, oh my gosh, how am I going to get so much in? Well, before and after you eat a meal, I encourage you to drink at least 10 ounces of water. And then in between, you drink more water. And of course, you're exercising, because when you exercise, that increases your immune system response to fight off all these viruses. So it's important that you hydrate because that also helps to get rid of toxins. And
Yes.
especially with viruses, that helps to keep your mucous membranes moist
That
by drinking all of that water. Because I mean, some people are like, oh, you know what? I'm going to just go have some alcohol because, that'll help to get everything out. No, that ends up drying out
that's right.
your mucous membranes. And your mucous membranes need to stay moist to help to fight that bacteria or viral infection that you have in your system.
And I was so happy to hear that the medical establishment, the Western medical establishment's recommendation were to drink the water for those very reasons.
Mm-hmm.
I'm always screaming it, and sometimes people listen to the holistic doctor, but sometimes they don't listen to the naturopath, and sometimes they listen to the medical doctors and sometimes not. But my 97-year-old aunt left the hospital after staying in the hospital for 14 days with COVID with just 2 instructions: avoid the sugar and drink that water every 30 minutes to keep those membranes moistened. And it's also a rinsing agent
Mm-hmm.
as well. Nothing can take up residence. It's the swish system on the inside.
Mm-hmm.
And we need that so much. Tell us more about your experience, Dr. Michele.
Wow, that could be a whole show into itself as far as my
Yeah.
experience. But I basically went through every symptom that they talk about, except I did not lose my taste or my smell. And I'm
Okay.
not sure if that's because it happened earlier on. But the other thing, in addition to taking my supplements, I did increase my intake of ginger, turmeric, garlic, and honey. One of my friends made a tea for me, and basically I drank that tea 3 times a day. And even now, every now and then, I'll still take it because I go out into the public. But as far as my symptoms and what I went through, it was probably one of the scariest times of my life because the virus isolates you from
Yeah.
whoever you're around, but it also tries to isolate your mind,
Mm.
your body, by just controlling how you feel.
Oh, that's a
Um,
good one. Say
yeah.
more. Say more on the
And when
mind
I say
isolation.
that, I could not watch TV. I couldn't listen to music. I couldn't look at my phone. I had
Wow.
to put my phone on mute, because every little sound irritated me.
Oh, so
My,
your sensory
my
perception was
Yes, and
increased,
even
heightened.
so to the point where I didn't watch TV. If somebody walked in my room, like if my husband just decided to bring my meal in, I couldn't really look at him because the movement was too much. It was making me feel
Ah,
dizzy. The only thing that really helped me was leaving my window open and listening to the sounds of the birds. Because one of the things when your body feels like that, you can't sleep. You're just constantly going
ah,
on. So it's not like you can get good rest.
mm.
So I like to say, and some of my other patients and even some of my employees have said, everyone has like this come to Jesus moment. It's almost like it's a spiritual journey that you go on, and like,
Yes.
okay, what now, God? Like, what is it? And for me, the end point was God said, He kept saying, I want you to share your story, and I want you to share your story. And I'm a very private person. I'm only an extrovert because of work.
Yay, ditto.
And people don't understand that.
Or believe it.
No, they don't at all. But I did, and I knew that that's what I needed to do. That's what I needed for myself in order for myself to heal. And God kept saying, I want you to share your story. And He said, now at this point in time, they will listen to what you have to say. And they meaning the population, they meaning patients, they meaning friends, people who all along I'm like, oh, come, let's exercise. Come, let's do this. And they're like, no, you go ahead and exercise. You doing the marathon and we'll be there taking some pictures of you. But we saw how our community was getting impacted when you had hypertension, when you weren't at a
Yes.
healthy weight, when you had diabetes. And I think for me, that was the spiritual part of it. And I don't want to say thank God for COVID, but COVID really has caused a mind shift in so many people that I think that is something that is important that we are really needing to focus on.
Agreed. And when you say the comorbidities in our
Mhm,
community, let me just ask you this. For me, I
mhm,
know that when they were first talking about the comorbidities in for the people who were possibly going to get
Mhm,
COVID and those who had COVID
mhm,
initially,
mhm,
I knew that our community it was going to come at our community locomotive out of control.
mhm.
And Surgeon General C. Everett Koop used those exact words to define AIDS in the 90s.
Mhm.
In the early 90s, he said that HIV was headed toward the Black community like a locomotive out of control. And everybody was like, but that's a gay white man's disease. But he used those words. And those words came back to me when
Mhm.
they spoke of the comorbidities that people with COVID were, or those who were going to be susceptible. And I was like, uh-oh, we have to get ready, get ready, get ready.
Yes. And it's interesting that you just brought that up because I went to the dentist earlier this week. And when I was asking the hygienist, is there anything different than what you're doing now? And she said, no. She said, basically, we're operating the same because this, for me, she said, it's like how we went through the AIDS pandemic
Ah,
and how we had to be safe. She said, this is the same exact thing that we're doing now.
yes. It's really interesting that you say that. And with our community, did you put up a warning sign? But I know that you have warning signs all of the time because you're always encouraging others
Mhm.
to do the workout. Do you think that it could have been far worse for you had you not been physically fit?
Oh, I know it would have been worse because of the impact and of how it hit my office because
Mm.
many of my employees, we exercised. And
Ah,
I am pretty sure if we hadn't been exercising, hadn't been taking care of ourselves, eating right,
yes.
it would have been devastating.
This
People,
is a stay ready, get ready moment.
oh, most definitely, most definitely. And I would even say that there are some people who used my story and that made them start to exercise and take care of themselves because they saw the impact it had on my body. And they're like,
Mhm.
oh my goodness, you're fit doc. And if this happened to you as fit doc, what could happen to me who doesn't exercise?
Exactly.
And that is what has propelled so many people to
Absolutely.
really start taking care of themselves. And I applaud them because
That's right.
that means that I listened to what God had said to me. And even though, some people don't believe in God, I do. I listened to what he said and the impact of what he told me he wanted me to do has gone beyond me. And I think that's
Ah,
what's important.
amen to that. Ah, yes. You're right, because the wake up is real. When they started talking about comorbidities and being overweight, I had been trying to ditch 25 pounds forever. And I was just like, you know what? This is it. This is the come to Jesus moment. So I have a renewed sense of commitment, Doc, and I have been I'm 6 pounds down, y'all. I may
Oh,
announce that.
very good.
Yes, because I have been completely on top of it. I've been putting in 9,000 steps before 9 in the morning. And because if it does not happen before the phone starts ringing, before
Mhm.
I start ringing phones, or if I ever turn on a computer, it never happens.
Yes.
If I wash a dish, if I do anything, if I do any chores, well, I will throw in a load of towels first. But I definitely always start with myself
Mhm.
because if I don't, the rest of the day just runs away. And
Mhm.
the excuses just mount up till you have got to get rid of them if you want to make change.
And that's the key thing. And that's why I encourage people find out what is the best exercise for you to do. It doesn't mean you have to join a gym because for me, you have to really be careful about going to the gym. But what can you do
Yes.
in your house before you even take a shower? There are so many different workouts. There's like a 10-minute workout, there's a 7-minute workout. So any type of movement that you do, of course, after your meditation, sets your mind right, sets your body right, gives you the energy, boosts up your immune system, makes you feel good and excited about everything else that you have to tackle for that day. But occasionally, I mean, it happens to me. I will exercise in the afternoon or evening because guess what? You know what? I had an early patient call that, sort of set my day off wrong, but I'm still
Mm.
make sure that if I don't start my day taking care of myself, I'm going to end my day taking care of myself.
Good advice.
I'm
Good
just as
advice.
important as everybody else
That's
in the
right.
world. Yes, and with everything that we have to do, just the two of us as doctors, we need to make sure we're setting that example as to what people need to do.
Express and good. And I am making every effort to do that. And I want to launch a campaign starting right here today called Workout Right at Home, because that's exactly where we need to be. You just heard Dr. Michele say she's not a fan of the gyms right now. Work out at home, your bedroom, your basement, your backyard, your
Mhm,
bathroom if you have to,
mhm,
around the house, the stairs.
mhm,
Work out right at home. But
mhm.
don't go away. When we come back, more with Dr. Michele, and we're going to have a conversation about when the flu and COVID collide. Yes, a continuation of last week's show. Don't go away. I'm Dr. LaJoyce Brookshire, and we'll be back after this. Welcome back to Ask the Good Doctor. I'm Dr. LaJoyce Brookshire, and we are here with Dr. Michele Reed, better known as the Fit Doc, board certified family physician. And we are having a conversation when the flu and COVID collide. Yes, we are going to be having this conversation and having this conversation and having this conversation until our numbers are decreased and you understand that you must take every precaution. What's my little song? Take every precaution. Yeah, take every precaution. Uh-huh. Because we need you to do that. The new stats, Doc, the predictions are now that by February, 181,000 people will have died from COVID. And that just makes me shiver. And for me, I'm wondering how you put out this kind of number without a solution, or making your only solution washing hands. I have a real problem, and wearing a mask. I have a real problem with that. And I believe that they're having the wrong conversation. Now, you're a part of this group, but you're on a totally different trajectory. You're teaching your patients and you're educating in a completely different way.
Mhm,
How can our communities avoid this pitfall of falling into the number? We know reducing the comorbidities is number one.
mhm.
What else say you?
So you know what? That's a very interesting question because if we think about it, we see, especially in the brown and black community, that we will get COVID at a higher rate.
Mhm.
And that's across the board, blacks and Hispanics. And knowing those numbers, you want to ask, so why aren't we doing anything different in our community?
That's it.
And for me, if I think about it, we can say, okay, March, April, things were starting to get shut down. What were people doing in their house
Hmm.
from April till now?
Yes.
You were eating, you were eating a whole lot more.
Jonking it up. Everybody's talking about that COVID
Yes.
15.
Yes. I mean, and in some cases, even 25 and to 50 pounds, I've heard.
Mm.
And you're eating foods that aren't healthy for you, because we always like to say food is medicine.
Yes, it is.
And so if we're eating foods that are not healthy, we're eating more preservatives. So that in turn is affecting our immune system. We're drinking more. So a couple of weeks ago was National Alcoholic Awareness Month. And
Oh,
you
you mean alcohol drinking?
Yes, so
Oh,
no alcohol. So you were not supposed to drink alcohol a couple of Fridays ago.
ah,
But we know now with COVID, especially Black women, there's an increased rate that we've been drinking alcohol during COVID.
wow.
And then on top of that, we're seeing increased mental health
No doubt.
patients coming in because we're all depressed, we're all anxious, we're all going through something on some level. And when I say
We
all,
have
I'm
COVID.
talking about all of us.
We have COVID fatigue,
Yes.
indeed. Hmm.
So with those things going on, I'm asking what's been the shift here?
Mm.
Say, you know what? This is affecting me. This is affecting my mom. This is affecting my dad, my brothers, my sisters, my
Yeah.
children. What are we going to do different? And yes, we know that we're supposed to wash our hands. If we don't have access to soap and water, use a hand sanitizer that has alcohol in it or make up our own.
Hmm.
We know that we're supposed to wear our mask, even though some people like to wear their mask underneath their nose,
Underneath their nose,
up
doing
here,
nothing.
or on our chin, or not even wear a mask at all.
That's it.
So For me,
Okay, let's pause
mhm,
right there.
mhm.
Wearing no mask at all. This is really, really rolling the dice. How simple is the task? And when we have our chief in charge who refused to do it and has succumbed to COVID himself, let's talk about for just a moment. I just want to digress. What do you think about the Trump treatment? And would that be a course of therapy that you would ever recommend?
So it's interesting that the day that he was diagnosed was the same day that my godfather, his funeral was.
Wow.
And he died from COVID-19. He was in the hospital. He did not get the same treatment that
Mm,
Trump was given.
mm,
And we do know, especially in the field of medicine, and you've been in the hospital too, Dr. LaJoyce, that some people get VIP treatment.
very true.
So the fact that he was given VIP treatment, of course, will help his outcome with COVID. But if science is saying to cover up because we know it gets spread by respiratory droplets,
Yes.
then everybody needs to follow through and do the same thing. But we're finding out that until it affects you directly, as far as
Yes.
your person or someone in your household, you don't believe it.
Come
And
on.
that's sad to say.
It is. It is.
And until people change their mindset or maybe they get impacted directly, it's not going to change.
All
Because
right.
here in New York, we have certain populations, especially pockets in Brooklyn, where we're seeing Orthodox Jewish people
Yes.
totally,
Causing a ruckus.
yeah, totally defying what is being told as far as the number of people that can gather, the number of people that are gathering and not wearing masks and still getting fined.
Yes.
Until we can equalize the situation and show that, you know what? It doesn't matter what's going on in your community. It's everybody's community. We're all interrelated. Because guess what? I
That's right.
might travel into your community. The last thing I need to do is to travel into somebody's community and bring something home to my family.
Very much. That is absolutely, absolutely, like the kids say, facts.
Mhm. And
Those
right
are,
now, I mean, we're living, despite everything that has happened with COVID-19, we are still living in a very selfish society.
yeah, let's talk about that because, yeah, you're a doctor who had COVID.
Mhm.
Were you on the street in 5 days? How long did it take for you to recover and to feel like you were out of the woods enough and no longer infectious before you went back into a situation in front of patients or other people? Took yourself out of quarantine in your own home.
All right. So that's kind of a loaded question. Had to close my eyes to think about it because I'm still not 100%.
There we go.
I still have my heart that races. This body
Mm,
right here, this temple that has run 3 marathons, that's 26.2 miles, three
wow.
times, can barely run a little over 2 miles without stopping.
Wow.
So if that's happening to me, who was in great shape
Oh,
before this
absolutely. Could
happened,
attest to that. Definitely.
no one knows the long-term impact that is going to have on other people who weren't in good shape.
Okay.
And, we're even seeing doctors who, emergency room doctors who ended up getting COVID, who were on ventilators, some to the point where they had to go through physical therapy in order to walk again.
Absolutely. Absolutely. I've seen a lot of that.
We are being very selfish if we're not taking the proper precautions to protect ourselves, to protect our family, to protect our coworkers. And as far as me going back into society,
Hmm.
I don't think I stepped foot back in the office and probably about 4 to 6 weeks later.
Aha.
And even now, I still am working remotely from home because guess what? There are so many people in my practice who don't even want to venture out of their house and have not ventured out to their house. So I
Yes.
can't even ask them to come into the office, but I
Understood.
need to service them. So I am the one that is servicing them from home.
Got it. And this concept of herd immunity, first, let's define it. Herd immunity is a form of an indirect protection from infectious disease that occurs when a high percentage of the population has become immune to an infection, either through vaccination or previous infections, thereby reducing the likelihood of infections of individuals who lack that immunity. What do you think about that?
So right now, this is not going to happen with COVID-19.
That's right.
SARS-CoV-2,
That's right.
severe acute respiratory syndrome, coronavirus 2, it's not going to happen.
That's
And
right.
the only reason is because this virus mutates.
Every 16
And
days.
because whatever was in China is different that was in the European country,
Right.
and whatever is here is different than what was in China. It's closer to what's in Europe. With that being said, we're now even seeing cases that are now documented. And I think recently there was a woman, a Dutch woman, that recently just passed after her second reinfection of COVID-19. And they
Mm-hmm.
from a different strain.
That's right.
So we do not know enough about this virus that to say, okay, I got it one time. And for me, as Fit Doc, I'm never ever going to get it again because I now have immunity. No, I don't.
That's right.
Because it is constantly mutating. And we can't even say that because I had a really bad case of it, that my next case is not going to be as bad because there were 2 documented studies or cases that just came out recently this week where 2 individuals in the United States were reinfected with different strains
That's right.
that caused worse symptoms what they had before. So herd
Second
immunity
time around is
right
worse.
now, yes, is not applying to us.
Mhm.
And the key thing, and I mean, I keep saying it over and over, we just have to be able to protect ourselves. We can't be selfish. We really have to feel that our skin is in the game because guess what? Our life depends on it. And if
That's
it's
right.
not your life, it's your child's life. If it's not your child's life, it's your spouse's life, or your mom's life, or your dad's life. Somebody's life depends on your action or your lack of action.
Amen. Amen to that. Dr. Fauci said that this trajectory that we're currently on with the virus, it's
Mhm.
getting worse and worse. Do you think that we need to shut down again?
I would not be surprised if we shut down again.
I would not. I think that this is the only way. When the flu and COVID collide, what do you predict will happen?
Well, I definitely feel that we probably will be shutting down again. Right now, especially here on our East Coast, the weather is nice. But as the weather starts to get colder, people are going to be in closer confines. They're going to be missing
Mhm.
family. They're going to be missing friends. We're even seeing college campuses where the numbers, instead of going down, they're going up as far as
Sure,
COVID-19 infections. So,
sure.
with that being said, eventually we probably will have another shutdown.
I
But
think it's really the only way to manage it. When I started doing research on the Spanish flu,
mhm,
this is how they handled it.
mhm,
Everything stopped.
mhm,
We're going to have no people to participate in the economy if we continue in this vein.
mhm.
So we have to take a pause instead of worrying about the precious economy and just be over it. This is my recommendation. Wish I was a Surgeon General right now. I'd put that out. But I think we need to understand quite clearly that as this COVID goes away and comes back after year after year after year, that is going to come back less and less violent. It's not going to
Well,
be,
that's what we hope. We don't know.
well, yes. Well, it's a coronavirus, just like the common cold was.
Mhm,
And 200 years ago, when the common cold was so deadly.
Mhm.
Every year it goes away, it comes back, it's less and less lethal. And then we're moving from pandemic to endemic where it
Mhm.
lives amongst us. And
Mhm.
you're right, that's what we're hoping.
That's what, because I mean, the thing is, we don't know enough. And even with the trials that are going on now for the vaccines, you know, over in the UK, we're working on the same drug, the same vaccine, but the UK paused theirs, the US paused theirs. The UK is back working on the vaccine, but the US is still paused for that
That's
particular
because
drug.
it's a 100% epic failure.
Yeah,
Because there's no fast tracking a
there
vaccine.
is
It
nothing.
took
There
it
is.
took 50 years, 50, 50 years to come up with a chickenpox vaccine.
Mhm.
50. What are we fast tracking by a certain date? Do not be deceived. That
Well,
is, it's just an impossibility for it
I
to be
don't.
safe.
Yeah, I don't believe that's going to even happen by a certain date. I mean, and there's no reason to rush. Yes, children are starting to get involved now as part of the trial. I'm pretty sure you've been seeing lately that the media has been trying to work with different agencies to get more Blacks and
Oh,
Hispanics
yes.
and Indians, American Indians involved in trials.
And we're
But
shaking our head no. We're remembering.
but
We're
this
remembering some things that have
But
happened to us
this
in the
is
past.
something that cannot be rushed because there are lives at stake. And,
Yeah.
we have to really think about, what is happening, what is the importance of what we need to happen. But I think for me, especially as a doctor, the need is for us to be safe and to be
Mm-hmm.
healthy. And I don't like for us to rush through things, even if you come for a visit. I mean, we try not to rush through the visit because we need to hear everything that is being going on with you. So we can't rush through a vaccine.
That's right. What are your top tips for keeping the body healthy that you share with your patients and family?
Well, 80% of your health is what you eat.
Yes, it is.
So the more natural the food, the better off you are. One of the things that I think I was even reading about lately is how we're talking about our food. So even if
Mhm.
the food is grown and it is, organic, our soil is totally different than the soil that our ancestors had, our
Right.
grandparents, and doesn't matter what country, because we're all using pesticides because we need to grow things bigger, faster, stronger, and better than what we did
Problem.
before. But the best thing, of course, if you can, is grow your own.
That's right.
And if you can't grow your own, try and have foods that are healthier for you,
Yes.
avoiding anything that is processed. I mean, that is one of the things that I like to encourage people to do. You have teeth, use those teeth to chew up your food as opposed to drinking food.
There you go.
Um, get your exercise. I encourage you to exercise if you can, 5 days a week, 6 days a week. Remember, you have to get rest. 7 to 8 hours of sleep is great. If you can do 8 or 9, that's even better.
That's
But
right.
your body needs time to rest and reset and recharge. Even
And
your
repair. Let me
mind.
throw in another R, repair.
Yeah, that's right. That's right. So even if I decide, you know what, I'm going to go for a 20-mile walk or a 20-mile bike ride today, I'm not going to tomorrow decide I'm going to go do the same thing. No, my body does need to rest.
That's right.
Rest and repair. The muscle cells do need to repair.
Mm-hmm.
Pineapples are a really good fruit to
Ah,
have, especially after you've been exercising as far as muscle repair. So eat right, get your rest, exercise, and just enjoy life.
that's it. And pray, you all, and meditate.
That's right.
It's all vitally important. We have to take care of our mind, bodies, and our spirits.
Mhm.
Because as we continually are plagued with the three pandemics, COVID, racism, and mental health,
Mhm.
we have to do all that we can to stay even so that we can fight this journey. We're traumatized to the
Yes,
max. We
yes.
are continually traumatized. There is always something happening that further traumatizes us. We cannot catch our breath.
Mhm.
So like Dr. Michele is saying that she can now only run 2 miles, may I encourage any of you who have had COVID. There is a supplement that helps with lung repair. Dr. Michele, think about this. It's called reishi mushroom, Reishi mushroom. It really helps lung repair. It was really good for me. I had a bit of bronchitis in the 90s so badly that I could not get rid of it after 3 rounds of antibiotics. And finally, I knew to crack open my Back to Eden book by Jethro Kloss, and reishi mushroom
Mm.
helped get me back and help the breathing and help the lungs and help to strengthen the lungs. So we thank you, Dr. Michele. Please tell our audience how they can be in touch with you.
Well, definitely you can get my book, Mentally Fit, Physically Strong, on Amazon. And you can reach out on social media, Facebook, Instagram, Twitter, Fit Doc Michele Reed. That's Fit Doc Michele with one L, Reed, Reed. And let's be healthier together.
Let's do it. Thank you so much for joining us.
No problem.
Don't go away. When we come back, more on Ask the Good Doctor after this.